Hi, my name is Elad Walach. I'm the CEO of Aidoc, and today we're going to talk about balancing innovation and execution for clinical AI. When people think about AI readiness today, they focus on things like, patent, innovation, and I think they're important for health systems as they develop their own AI. But I think there is an even more important facet, or as important, which is how do you adopt AI and actually make a change? And in my mind, that is the key. That is the key transformation we're looking for in the health system. Like we have this massive pain of system fragmentation, and AI can be this big solve. But the question is, how are we going to implement that change in the most successful manner? And when health systems, ask me, how do we prepare for AI, the AI revolution? And they typically ask about it from like a database perspective. Like, do we have the right systems? Do we have our data on the cloud? And I don't want to degrade from that element, but in my mind, even more important is having the right leadership. And that might be like a very weird statement, especially as a technology vendor. Like, why am I talking about leadership and people? But look, I think we bring in the technology. Technology is there, and I think it's pretty mature. Now the question is, can you benefit from that? And let me give you a real example, a story of two health systems. We had one health system for one of our workflows for pulmonary embolism for PERT teams. And we had two big implementations roughly at the same time. And one of them was with a health system with strong clinical leadership. And they heard the feedback from their physicians, but the chief clinical officer said, this is going to be our workflow. And he heard all the feedback, but basically implemented it. And they took 3 months to roll this out across the enterprise. That's option one. Option two was they had no clinical leadership. They had fights amongst, the 10 different divisions and still couldn't figure out the workflow. And, sometimes we're fighting for this 3% tweaks in the workflow, but not really solving the core issue. And that health system had over 50% leakage for that workflow, meaning 50% of patients that had to get to their PERT team did not get to the PERT team. So the impact is massive if we solve this problem, but because they didn't have the right leadership in change management process, they couldn't get around it. So in my mind, big part of AI readiness is actually having clinical governance, clinical leadership, and the right leadership in place to actually move quickly. And if you do it the right way, we see you can have very significant, very rapid AI implementations with a lot of impact. When you say AI readiness or being ready for AI, well, what does that mean, right? Do you want to be the best user of the technologies out there, or do you want to develop your own? And in my mind, I think obviously both are important, but for most of the market, I would say that the execution or being the best AI user is actually the most transformative part, because then you can benefit from the whole industry that is evolving in like an explosive way. So we want to be, I think health systems, first and foremost, need to be the best user of AI. And the best health systems that I know of that have the most AI workflows are those that can actually leverage external innovation. That is not to reduce from the importance and the value of internal innovation. So this is not a knock on that at all. It is just saying, I think, especially for the mass market, the right usage is, I would say, a faster path to transformation. So again, a lot of my question, my thinking is how I think about, AI strategy, or when New York health systems have set their own AI strategy up, a lot of it is what are our pain points and how can we use technology to solve those pain points in the fastest way?